Hello everyone. So today I'll be discussing the part 2 of the plasma cell disorder, and if you haven't watched the part 1 of the plasma cell disorder, then I will put the link in the description box below and please go back and watch it. In this video, I'll be talking about monoclonal gammopathy of undetermined significance, and I'll be discussing why it is important that we need to follow this condition and how to differentiate it from the multiple myeloma. The next topic I'll be talking today is Waldenstroms Macroglobinemia, what is the pathophysiology, the clinical features, peripheral blood smear, the complication and the treatment. So watch the entire video as I'll be discussing why there isn't hyperviscosity, why there is a rouleau formation, and how plasmapheresis are helpful in the treatment. Okay, so guys, if my videos are helping you, then please do like, share and subscribe. Okay, so coming to the mgus, that is monoclonal gammopathy of undetermined significance. Okay, in this condition there is an overproduction of any immunoglobulin. We know that these immunoglobulins are produced from the plasma cells, and these plasma cells are proliferating in the bone marrow. Okay, and it is an asymptomatic condition, unlike the symptoms we see in multiple myeloma. So in multiple myeloma, we see graft findings, but we do not see, there is no graft findings, okay, in MGUS. And what is graft finding? That is hypercalcemia, renal failure, nomocytic nomochromic anemia, and lytic lesion in the bone, which is absent. Okay, so no graft findings. When you do the bone marrow aspiration, you will see less than 10% of plasma cells, unlike the multiple myeloma, where you will see more than 10% plasma cells. Okay. And when you do the bone marrow aspiration, if you see less than 10% plasma cell, it is important that you need to follow up that condition, because there is a chance that 1 to 2% of this case they transform into multiple myeloma. That is where follow up is a must. Okay, and there will be increased serum with M spike on serum protein electrophoresis, and that will be mostly IgA, IgG and IgT. The next topic today I'll be talking is the Waldenstroms Macroglobinemia. In this condition, there is a proliferation of a B lymphocytes in the bone marrow. So these B lymphocytes, they will produce the immunoglobulins, that is IgM, and IgM is a pentamer, as you can see, and this is the largest immunoglobulin. So when they go to the circulation, they are occupying the larger surface area, and this excess IgM, they are thickening the blood, and that is leading to hyperviscosity syndrome. So coming to the clinical features, because there is an increased IgM, they can have features of hyperviscosity like headache, they can have visual changes, they can be bleeding from small fragile vessels like in the nose, so they can present with epistaxis, they can have cryoglobinemia, neuropathy, hepatosplenomegaly, lymphadenopathy and cytopenia. Why cytopenia? Because these plasma cells, when they are proliferating in the bone marrow, they are decreasing the formation of the normal cells. As a result, there is cytopenia. In the peripheral blood smear, you will see rouleau formation. Why? Because normally the RBCs are negatively charged, and these abnormal proteins which are formed, they decrease the negative charge of the RBC. As a result, there is the RBCs are stacked over one another like coins, and that's called the rouleau formation. Okay, and the next is the serum electrophoresis, serum protein electrophoresis, where you see the monoclonal M spike, mainly of the IgM. And when you do the bone marrow biopsy, which is a confirmatory, where you will see more than 10% clonal beta. And because there is more IgM in the circulation and that is thickening the blood, there is a high chance that the patient can have thrombosis. And how do you treat this condition? You do the plasmapheresis, where you take the blood of the patient and you take out all these IgM which are increased in number, and then you send the, again you give the blood back to the patient. So that's plasmapheresis, and it is helpful to decrease the symptoms. Okay, and you can also go for chemotherapy. So guys, this was the short video about mgus and Waldenstroms Macroglobinemia. And guys, again, please like, share and subscribe, and see you in the next video. Okay, thank you.